Hello, hello. Thank you. I love that. I love when people say hello back. We know that we're between you and lunch, so we're going to try to keep this as brief as possible. It is pretty much the same as other years. Benefits aren't changing for 2026, which is great news. Again, that's due to the administration and the foresight from LGHIB and keeping their benefits kind of progressive in the way that they needed to in order to keep up with those trends that we're seeing and medical costs that Dustin talked about. So again, my name's Karina Abrams. This is Melanie Rudy, and we are UHC. We work with LGHIB on a regular basis. And before we start, just 2 seconds, because we had to bring something kind of themed into this. In Alabama, there are some strange laws that were on the books, and we're just going to tell you a few of them quickly. One of them dates back to the 19th century, and it's aimed at preventing horse theft, because that was a big thing back then before cars. So you weren't allowed to put an ice cream cone in your back pocket. And again, who would? I don't know. But there was a law that said you couldn't do it because it was it was a way that horse thieves led horses away from their owners. So pretty interesting, right? You can still find it online. Also dating back in about similar time, it was also illegal to put salt on a railroad track. And because that could lure cattle onto the railroad tracks and bad things could happen. So that was punishable by death. How about that? So just thought that was interesting. We wanted to share it with you. So I'm going to let Melanie start off and talk about benefits, which are a lot less interesting, I know, and we'll try to get through those pretty quickly.
Hello, everyone. I get to follow all those fun facts. So first, thank you all for having us here and letting us speak with you today. So on our agenda, we're just going to go through some original Medicare basics, and then we'll cover the MAPD plan benefits and programs, and then we'll let you know what your members can expect next. All right, let's take a look at some original Medicare basics. I know some of the previous speakers have kind of touched on Medicare, but when someone becomes eligible for Medicare, the first step is for them to enroll in Medicare. And it's called Original Medicare, which is sponsored by the federal government. And that covers parts A and B, so your hospital stays and then provider visits. The next step would be for them to decide if they want additional coverage. Either option one would be through some sort of supplemental plan or Part D plan. And then option two is a Medicare Advantage or Part C plan, which is what we will be talking about. And the Part C plan combines A and B to create C, and then it usually covers Part D as well. All right, now we will take a look at the specific benefits for the LGHIB plan. And just a note, there are no changes for 2026. First, this is a national PPO plan, so members can utilize providers that are in or out of network, and it's the same cost share to them whether they use a in-network provider or out of network. And then if they ever have questions about if a provider is covered, they can call our customer service, we can look into it, or they can go online, and you all can go on the website as well. It's retiree.uhc.com/LGHIB. You can find the provider directory as well as some other resources on the benefits. And I won't go through all of these, but this is a highlight of some of the plan benefits that have not changed. And just to point out, the copays stay the same, whether it's in or out of network there. Along with the preventative services, $0 copay, and again, it is the same in or out of network. For the prescription drug benefits, there's no changes again, and as a reminder, the covered drugs are placed in tiers, so each tier has a different cost, and these costs can change based on the day's supply. There's a $100 pharmacy-only deductible that applies to the drugs in tiers 2 through 4, and tier 2 are preferred brand drugs, and they're covered at 20% for 30 or 100-day supply after the deductible has been met. And I will let Corinne step in here.
Thank you. So we talked a little bit last year about the IRA, which is called the Inflation Reduction Act, and some changes that were brought about to Medicare Part D by virtue of that act. So it was signed into law, just as a reminder, in 2022, and last year we had some changes. One of those was that what was called the coverage gap, or the donut hole, was eliminated. Essentially what happens now, and I'm going to move to the next slide here. What happens now is there are 3 stages. You have an initial annual deductible when applicable, so the deductible would apply, and then the member would pay their copay or coinsurance, depending on the benefit tier that we talked about a moment ago. And then that member moves into the catastrophic coverage stage whenever anyone, and that means us or the member, whenever our amounts go together to add up to $2,100 for 2026, that member pays a $0 copay for their medications for the remainder of that year. So again, if you remember, and again, if you don't, that's fine, but this year was the first year that went into effect, and that cap was $2,000, so it just increased by $100 for 2026. And then again, that's a change that was made due to the IRA, not the benefit structure, but again, that caps that member's benefit out of pocket once that amount is met. So once the total payments received for that member on their behalf is that $2,100. One thing that we also talked about last year that was new at the time was the Medicare prescription drug payment plan. This payment plan was also created under the IRA. It allowed participants to spread their copays over the course of the calendar year. So what happens is a member would choose to enroll in this program, and they can call into us. We're glad to talk to them about it on the number at the back of their card. They enroll into that plan, and then what happens is that those additional copays accumulate and then are averaged out for the remainder of the calendar year. So the member doesn't have that upfront out-of-pocket that they might have depending on what their medications are for the beginning of that calendar year. It's important to note that this may not be a good fit for those members who have a low yearly drug cost, who may not reach that $2,100 annual out-of-pocket, or who might have extra help or some other government program. And again, they can opt in through the plan online or call us or by mail. House calls, this is always one of my favorite benefits to talk about. I'm sure you're all familiar with it. We talk about it every year, but it's a really important program. It's a program where members can receive in-home care, so a clinician could come out to their home, and they spend up to an hour with members. They talk to them about their preventive screenings, they talk to them about their current medications, anything that might be of concern. And if you think about it, when you go to the doctor's office, sometimes you get home and you have those questions that immediately come to you as soon as you get home that you wish you would have asked. This is a great way for members to get those questions asked. So again, the focus is on preventive. Tailored health screenings can be provided, and also what we do is we send a summary to their primary care physician just to make sure that all of that care is coordinated. And if members would rather do it virtually, we do offer that through a video visit as well. Renew Active, I think most of you are familiar with Renew Active, and that's the program where it's a free gym membership to thousands of our gyms nationally. We also have on-demand workouts online, as well as live streaming fitness classes that members can do. So again, no cost to them, and if they have any questions, they can always call us to find out who those are. Let's Move is kind of a supplemental health and wellness program, if you think about it that way, for your MA members. So we've really been expanding this program. We want to focus on members' mind, body, and social lives. So we offer them different support, different ways to eat well. We do live teaching kitchens, which are pretty awesome. We do that once a month. We do some other programs and projects as well. We've had members recently who could opt into a program to grow certain plants during the course of a quarter. So that was kind of an interesting one that was most recent. We also link them to mental health and caregiver support services. There's caregiver once a month. We have a caregiver session on different topics that might be of help to them. We also do fun things like laugh yoga. Has anybody ever done laughter yoga? I always ask this question because I find it fascinating. Okay. Well, we also offer that too, which something that members can take advantage of. All right, so Healthy at Home. This is a really important benefit. So your members are eligible for this if they're inpatient in any way. So when they come home the first 30 days after their discharge from an inpatient stay, that's a really important time. We want to make sure that they're aware that they have benefits like 28 home delivered meals. So they have up to 28 of those they can decide to get if they want them, which is helpful when you think about it. If you're getting home, you don't want to make a meal. It's also 12 one-way rides to medically related appointments, such in pharmacy as well. We do also offer 6 hours of non-medical personal care, and that can be personal care like bathing, preparing meals, medication, delivery, all of those kind of things. So again, we want our members to take advantage of that, first of all, so that we can provide help, and second of all, so that they don't wind up back in the hospital from trying to maybe do things that they shouldn't be doing. So again, it's a really important benefit. Our new for 2026 app is the Calm app, and you may have heard of the Calm app. The benefit for your members is going to actually be expanded, so it's what you hear on the commercials, so they can go in and they can listen to those great things, and which enables them to go to sleep. That's the one I always think about, or to relax, so guided walks. But they can also tailor their experience. We'll ask them to complete a short mental health screening, and then they will suggest programs that members can take part in and participate with. So again, we're excited to offer this for 2026, and we'll be reaching out to members who may benefit from that through our campaigns. Finally, on hearing, we encourage your members to utilize UHC Hearing for their hearing aid benefit. We can offer up to 50% off of the standard industry price. We can also offer certain over-the-counter hearing aids as well. So they would need to call UHC Hearing for that. There is a flyer in the materials that we gave you in the bag, so in the blue bag. If you want to take a look at that, members can be directed there, or they can call the number on the back of their card, and we can help them with that process as well. Again, we want to make sure that they maximize their benefit. With that, and before I turn things over to Melanie to bring this home pretty quickly, just want to tell you one more strange Alabama law. Just because this is very specific, guys. In Lee County, it's illegal to sell peanuts after sundown on Wednesdays. So, I don't know if any of you would want to make some extra cash on the side in Lee County, but don't do it that way. Melanie?
I'm going to have to look into why you can't do that. All right, so we will wrap it up by looking at what to expect next for 2026 for your members. So once a member is enrolled, so this is for new plan members who may enroll into the LGHIB MAPD plan with UnitedHealthcare, they'll receive a welcome letter and their member ID cards. And with that ID card, they'll be able to register online and access all their plan information beyond that public site that I had mentioned previously. And then once the plan is effective, they will use their member ID card to go to the hospital, their doctor visits, and get their prescriptions. And then UHC will reach out to new members just to welcome them to the plan, and then we ask them to complete a health survey and just provide some reminders that may be relevant and some programs for them. And if they are already on the plan come January 1st, they will not receive a new ID card. They'll just keep their previous one. They'll continue to use that. And again, no changes, so they won't have to look in the mail for any new card or anything. And that concludes our presentation.
Great. Thank you.
All right.
We appreciate you.